All right, Merck is asking for emergency authorization. What exactly does this mean? Explain this again.
Right. Well, basically, this emergency use authorization is basically a status of a medication being approved by the FDA. Now, with this emergency use authorization, it has not been fully approved with unlimited restrictions, but it's basically approved temporarily until it can be reevaluated for a full approval. And we saw this with the Pfizer vaccination. Initially, they got the emergency use authorization, but since then they've gotten the full authorization without the emergency use status, which is unlimited for 16 years and older. Basically, this is in a scenario such as we are in now with the coronavirus, where a lot of people are losing their lives very quickly, and emergency use has to be granted because the benefits outweigh the risk according to the most recent data derived from the research. So that's where we are right now.
Dr. Quinn, we've been reporting that this drug could cut hospitalizations in half. Is that right?
That is correct. I mean, I'm looking at the recent report, and basically the quote was right on the money: cut the risk of hospitalization and or death by about 50% in high-risk people with mild to moderate COVID-19. Now, when they mention high risk, they're referring to people that have risk factors such as older age, 65 or older, or medical conditions that can make them more vulnerable, where if they contract coronavirus, they're not as easy to fight it off as, say, somebody that's younger and healthier. So, someone that might have diabetes, heart disease, asthma, anything that could potentially weaken your immune system. But the good news is this medication is really looking good right now.
Dr. Quinn, the drug has been compared to Tamiflu, which is used to treat the flu. What are the side effects? Do we know?
Well, right now, according to the research, according to the reports that I've had the opportunity to evaluate, the side effects that are being experienced by individuals that were in the clinical trials that took this medication are very similar to the side effects of the placebo, meaning the people that took a medication or what they thought was a medication in the clinical trials, and it was basically like a sugar pill, a fake medication. So the side effect profile is looking really good, but the reason they're comparing it to the Tamiflu is, like Tamiflu, it's an antiviral, and Tamiflu, as we remember, we take it for the flu, and it works very well. But with this new medication by Merck, if you contract coronavirus, you can take it, and it has the same benefit. Basically, with this new medication by Merck, what it does is it slows down the virus's ability to replicate, meaning that the person can recover. And we're talking about a 50% decrease in people going to the hospital and a 50% decrease in people losing their lives. So this is very exciting right now. In the medical community, we're very excited because we want this tool in our arsenal so we can continue to fight for our patients.
Real quickly, one side effect I see is the price on this thing is set at like $700 per treatment. Is anything going to be done to kind of make this more affordable?
Well, let me just say this now. If you look at the medications we're using right now, which are those monoclonal antibodies, it's a lot more expensive.
Oh, is it?
So the bottom line is the insurance companies, they're going to help pay to offset a lot of the price, because you have to think about it. The insurance companies are in the business to help people, but they're also in the business to make money because it's a private entity. And if they can decrease the cost of the medication, people take the medicine, not go to the hospital, then they're going to save money. So I feel 100% confirmed that the insurance companies, they're going to have to offset the prices, and they will do that because at the end of the day, they want to keep people out of the hospital, and especially they want to keep people from losing their lives.
Great. Sounds like good news all the way around. Thank you, Dr. Quinn, for being with us again today.
Hey, thank you.